Chiropractic. I'm Liz Tolan, and I'm here with Dr. John Degenhart, Dr. Stacy Sando, and I've got Toni and Kristin with me. And Dr. John, we are going to continue our series on massage therapy and wellness.
You know, the two massages we're going to talk about today, Liz, it's not like your average massage. So I think the viewers are going to be very excited and surprised to see that there's different type of massage therapy. We've been doing it at this office probably for like 20 years now. So I'm excited for people to actually come in our office and see what it's all about.
Well, when we're back after the break, we'll tell you about the first massage we're going to show you, and we're going to let you have a sneak peek so you're right in on the action. Stay here. Let's talk chiropractic only on WYLN. We're back in a minute. Let's Talk Chiropractic. We're continuing our series on the benefits of massage therapy. And now, Kristin, you are going to take us into the massage room, and we are going to talk about hot stone therapy.
Okay.
So tell me, the hot stones, what type of patient would you recommend that for?
The hot stone is good for anybody who wants a relaxation massage. Anybody who has chronic tightness, muscle spasms, and just relaxation.
It looked like it was very comfortable, and we're going to go have a look. And we're now joining Kristin. And Kristin, you're going to be giving your patient Toni a hot stone massage.
Yes.
Okay, well, tell us a little bit as you go how this works.
Okay. We like to do a hot stone massage because that helps relax the muscles. It helps relax the tension. So what I'm going to do is I'm going to uncover him, and I'm going to put a towel on his back, and I'm going to place the hot stones on a towel. You never want to put the stones directly on the skin. They're 135 degrees, so they can burn.
So they can burn.
Yes.
And I guess now, if this is going to relax the muscles, you might want to use this for a patient who's having muscle tightness or muscle spasms.
Muscle spasms.
For muscle spasms.
Mm-hmm.
And again, I guess communication is important. I guess Toni will tell you if he's uncomfortable or if the heat is too intense,
Yes.
and you can make an adjustment.
Yes. And we also like to do it for relaxation. It is definitely good for relaxation also. So we put a stone at the sacrum, and then we put 4 going up both sides of the spine.
And these are very smooth
These
stones?
are very smooth stone. They're called basalt stones, and we like to use the basalt stones because they hold the heat in better than other stones.
I see. I see. And you've warmed them in warm water,
They
or hot
are.
water.
Yes. We have them in a pot. It is about 130 degrees. It's average to keep it between 120 and 140 degrees. 130 seems to be one of the most comfortable temperatures for them and for us, so we don't burn our hands also.
I see. So you've spoken to the patient, you've determined that the hot stone therapy is probably the best treatment for what he needs, and now you're placing the stone in a pattern over certain areas of his back, as you said.
Now,
and then what happens next?
Earlier he said he had pain in his low back.
Okay.
So this here is definitely going to help relax the tight muscles here going up his back.
Okay.
So as these are relaxing his muscles, I'm just going to massage his legs.
Okay. So you're using a little bit of the normal or the traditional, if you will, massage in addition to the hot stone.
Correct.
And I guess now, we were talking earlier about comfort of the patient. And I guess the patient, for this therapy, they could disrobe or they could leave on a loose piece of clothing. It's up to whatever they're comfortable with.
Correct.
Okay.
If they wanted to leave their shorts on, you know, we can work through that.
Whatever they're comfortable
Whatever
with.
they're comfortable
And
with.
we were also mentioning that we can either put music on or not. We can use your oil or lotion, or they can bring their own. Whatever they're really most comfortable with.
And for a hot stone massage, it's best if you use oil. Lotions will tend to be sticky, and for a guy, it will pull their hair, and it could pull the skin. So oil is definitely.
So you
best.
you actually have a stone in your hand
I
with
do.
the oil.
I do. I am actually massaging
With stones.
With the stones.
I see that.
And it's good to flip them so it's not too much heat in one spot.
Wow, so you're using oil and a warm stone to get deep into those muscles, but not too deep.
Not too deep.
You're really letting the heat do the work more so than the pressure.
Yes. And with the heat, that's going to relax the muscles so then we don't have to work as deep with our hands.
I see.
It saves our hands and our wrists.
I see. So this is a massage. Now you would do the massage. This would be a full body massage.
This is a full body massage.
So when you're done with the patient's legs, and then you would remove the stones from the top, and then you would also use the stone and the oil to massage the upper body as well.
Correct.
I see. I see. And Tony certainly seems very comfortable. He doesn't seem like he's having any discomfort whatsoever. But I guess if the clients had any discomfort from the heat, they'd let you know.
Yeah, they would
And you'd
definitely.
cool the stones down
Yes.
a little bit.
So naturally I would go over and do the other leg.
Mm-hmm.
And like I said, you would do the back.
Mm-hmm.
And when you're finished with the back, you would flip the patient over and
Okay.
place the stones in the front.
On the front too. Okay, so if you could just to wrap it up for us with the hot stone massage, patients that you would recommend this for.
Anybody who has tight muscles, muscle spasms, there's people that you don't want to do it on. You don't want to do it on anybody that's pregnant because it does make the inside of the body hot.
Elevates the temperature of the body.
Elevates the temperature, yes.
All right. Well, Kristin, thank you so much. Tony,
you.
thank you for letting us join you in your massage. Well, that looked like a wonderful massage. And you know, Kristin, I'm going to have to try that next time I come in to see you. Because I've never had one of those, and it looked very comfortable, and it looked warm.
It is. It's very warm. It's very relaxing. I've had hot stone massages myself, and I do recommend to get one.
Well,
They are
next
very
time I come in
nice.
for my appointment with you, let's remember that and mark that down in
All
my
right,
chart.
we'll do that.
Liz, I'll tell you too, like every type of therapy we have in the office, Dr. John and I have gotten ourselves different types of massages, different types of physical therapy that we do here. So we don't recommend to our patients, hey, go try that, and we haven't done it ourselves. So the hot stone is definitely relaxing, lymphatic, I think you're going to talk about next, and that has wonderful benefits.
Well, and Tony, after the break, we're going to be joining you, and we're going to be talking a little bit about the lymphatic massage. And we're also going to talk about how we can do these treatments for a number of reasons and in a number of different ways. So when we come back after the break, we're going to be talking to Tony about the benefits of lymphatic massage. Stay right here. Let's talk chiropractic. We'll be back in a minute. Welcome back to Let's Talk Chiropractic, and we're continuing our series on the benefits of massage therapy. We've seen hot stone therapy so far today, and now Tony, in a moment, you're going to take us into your room, and we're going to be doing a lymphatic massage.
Right.
Tell me a little bit again, what types of patients would you choose this massage therapy for?
Well, this massage would be a benefit to almost everyone because it takes care of inflammation, and almost everyone has inflammation even if they're not aware of it. But everyone at the end of the day probably has swollen ankles, or a lot of people complain of carpal tunnel. People have allergies. They have, in special cases, people have lupus, or just even it can help eliminate depression, anxiety, stress. It's good for almost everything.
So it's kind of a cleansing, clearing
Right.
type of a massage.
It helps to boost the immune system and to balance out the fluids in the body, so it creates a homeostasis in the body.
Wow. Well, I'm looking forward to seeing this one. Let's go check it out, lymphatic massage. We are now joining Tony and Arnie. And Tony, you're going to give us an example of a lymphatic massage. Is that correct?
Yes.
So I guess first, because I'm not familiar with this particular type of massage, tell us what the difference is between a lymphatic massage and a normal massage.
Well, with a lymphatic massage, we're moving the fluid in the body, which is the lymph fluid, which is goes hand in hand with the circulatory system,
Okay.
which is the blood that moves. The heart moves the blood throughout the body, but the lymphatic system, which is the clear fluid in the body, does not have an organ to move it. So it depends on regular body movements like breathing, walking, and other exercises. And sometimes that's not enough. And so we're helping to move that fluid so that we can eliminate certain things like edema, which is swelling, and other problems.
Fascinating. So I guess we've been talking all along about the relationship between the therapist and the patient. And I guess before you did anything, you sat down with Arnie and you talked about kind of some of the issues that he might have been having with his health or his wellness. And then you determined this was a good massage therapy for him versus, say, cupping or hot stones or any of the other treatments.
Yes.
Okay. Now, and I noticed with Arnie too, I noticed that he is fully clothed. So this is a type of a therapy where you don't necessarily need to disrobe.
Right. Sometimes people are reluctant to take their clothing off. And so really we could work around that, whatever they prefer.
Whatever they're comfortable with.
Yes.
So they could take this therapy, they could either disrobe or they could be fully clothed.
Yes.
Already. And then just kind of give us some idea of what this massage entails.
Okay, well, what we need to do is the lymph nodes are throughout the body, but in certain areas they're concentrated. And those areas are the sternal notch, the axillary, which is under the arms, and the inguinal area, which is where the legs meet the body. And also there's some behind the knee. They're throughout the body, but in the concentrated areas, that's what we want to stimulate so that it's going to help to pull the fluid throughout the body. And we stimulate those areas first, and then we just actually lift the skin and move the skin toward the direction of the heart, because the fluid is going to eventually go from the lymph nodes to the circulatory system and then clean. So it's like detoxing the body also.
I see. And would this be a full, so this would be a full body massage?
You can do a full body, but right now we are just working on his legs because his problem was in his leg.
So he has a bit of edema from a pre-existing injury, and so you're just trying to cleanse and to detoxify that
Help
area.
to move that, break up the stagnation and move the fluid so that it can be cleaned.
I see. Now, Toni, would you be using any other types of devices or oils or lotions for this massage?
No,
or
that's not necessary because you're just going to use actual light pressure, and instead of going down like other massages, you're going to go horizontally.
Alrighty.
And you just move the skin ever so slightly.
And it looks like a very gentle treatment. It doesn't seem like Arnie has any kind of discomfort or anything like that. And I guess with all massages, the communication is key. Again, if he was uncomfortable at all, he would let you know, and then you would adjust your touch accordingly.
Right. But it's very light, and that's a lot of people are amazed when they get results because it's just so light.
But it's the technique, I guess, that's bringing out the results. Okay. So what types of patients would you recommend this for?
This could be used for anyone if you have arthritis, if you have edema, which is any kind of swelling, which could be swollen ankles, carpal tunnel, even on the face if you have dry eye, if you have fibromyalgia.
So you could do this on your face?
Yes.
This type of massage as well? Okay. Is there any patients that you would not recommend this massage for?
People that have renal failure,
Okay.
or extreme heart problems. But other than that, unless there's, an acute injury,
Okay.
things like
Or
that.
something's healing. You'd want to let it heal, and then you'd use this treatment
Well, actually,
afterwards.
you can use it post-surgery for hip replacements and knee replacements.
Really?
Mastectomies.
Wow. Okay. And then I guess, now this is a 1 hour massage generally, or a half an hour massage?
You can make it as long as,
as
you,
long
as
as
you
you
want.
need. And a number of treatments, or just one, or how would you approach
Well,
that?
they can get immediate results from one massage, but it is better to get at least 3.
But you might see results right away.
Yes.
All right, Toni, thank you so much for showing us this massage, and
You're
Arnie, thank you for
welcome.
letting us sit in. Well, Toni, that was an interesting massage, and one thing I noticed with that patient, he was fully clothed.
Yes.
So this is the type of massage that you can do with your clothes on if you're more comfortable. And I also did notice with him, he said that he felt an immediate benefit to that massage.
Yes, this was a patient who we weren't even aware of it, but he had no feeling in his toes for about 2 years.